Hey everybody, happy Friday. It is almost Halloween, so you just got to get into the spirit. So no clowning around. Huh? Hey, I wanted to put together a summary that had to do, let me get rid of this, that has to do with scars and why in my practice and many of my colleagues who deal with pain management, we have found a very useful technique of treating scars that may be still producing pain. It could be producing pain from a recent surgery as many as a couple of months ago, but it could be something years old. And we, in our program, when we teach civilian and military doctors techniques of medical acupuncture, it's clear that many scars that we have found in clinic tend to still be provoking and still may be producing a source of pain for that patient. It may not be directly right next to the scar, but it might be deeper into the layers that were repaired as part of the surgical procedure. And these, amazingly, it doesn't seem to matter necessarily the size. These could be very small scars that may be related to laparoscopic surgeries. I've seen this be an issue around, say, an arthroscopy scar, somebody's knee or shoulder, where the scar itself may still be provoking a local area of fascial irritation, mild inflammatory reactivity, however you'd like to term it, but the word we like to use is an active scar. Now, many scars don't have this quality, and we don't treat all of them in this way, but sometime back in the European literature, the technique of using lidocaine, just plain lidocaine, lidocaine we all know as an anesthetic, but they found, interestingly, that use of lidocaine could be used as an anti-inflammatory. Now, we'll usually start with techniques with myofascial work. Many of my physical therapists, myofascial therapists, folks who do Rolfing, more advanced visceral therapy, are fully aware of the concepts about levels of tissue that may be affected by a scar, a wound that was repaired, or maybe it was left to repair on its own, that are still being reactive, that would be helpful to get that scar to be more movable, more mobile, not so stuck down, not so scarred down. And those of us who are fascial therapy providers, including those that do hands-on work in acupuncture, find this actually may block energetic movement in the fascia. Well, that could provoke irritation in other places that wouldn't seem to be so direct. So in our acupuncture world, we think of scar deactivation as a method of getting these channels in acupuncture terms to get flowing again, to provide a reduction in fascial restriction, which can provoke, it could be pain, it could be numbness, it may be visible, palpable changes with lymphatic flow, with venous flow. In acupuncture terms, there are terms such as channels or meridians that can cause blocks if the scar is producing a block. And as I mentioned, it could provoke an inflammatory response. Many who may have had an abdominal wound, of course, there's many different surgical approaches. In clinic, one of the most common surgical sites that we see is a hysterectomy scar. This may be related to a tummy tuck surgery. It could be from a C-section. So really, if a three-dimensional way of thinking about these scars, we understand that there are fascial beds below this, we know that this may be something worth treating. Here is a post-mastectomy scar, and here are surgical sites that may be used in the old days for prostate cancer surgery. The one on the left would be more for the old style, and the one on the right would be ports that are used during robotic surgery. But again, no matter how small those scars are, they may still be actively producing local pain. Directly underneath those tissue layers are beds or are extremely long and sometimes fascinating distributions of fascia, which is what you see in these diagrams from Tom Meyer's book about fascial trains or anatomy trains that talk to the idea that myofascial components of pain are very, very important when it comes to pain management, not just skeletal issues with bones, but the fascia and the soft tissues that surround and penetrate muscle and ligament, essentially all the tissues that we would think about. So imagine on the left, if some person were to undergo a thoracotomy or a surgery through the chest wall, what that would entail, how that would impair someone. Shoulder surgery, upper neck surgery, cervical spine, abdominal surgeries, as you could imagine, low back surgeries, laminectomies, discectomies, surgeries done for fusions, how the fascia on the lower back would be affected. And these all in blue demonstrate the fascial trains that Tom Meyer's author cited below has included in his text. So again, what and how do we treat these? You can treat scars with acupuncture needles. There's a technique of using acupuncture needles to surround, almost basically create a perimeter around the scar to release the scar, allow it to become less stuck down. You can also use electrostim, which is a technique of connecting those needles to stimulation at different frequencies. That can be very effective. One of our more advanced techniques is actually injecting the scar tissue in a three-dimensional way. But thinking of scars, we have to palpate the scar. We have to palpate the fascia, that blue diagram material in the diagram earlier. Those deeper layers where sutures, where tissue planes were brought back together again by the surgeon and then stitched together and repaired with suture. Those areas often tend to be sensitive. They could be numb. They may be hypersensitive. So we pay attention to those areas and we would treat those potentially with injections using nothing more than plain lidocaine, a local anesthetic, which, as I mentioned, acts as an anti-inflammatory. We also think there's a component of just providing a certain amount of infused volume to expand that tissue to give the fascial layers more room to move and slide so things aren't adhered down so much. And sequentially, week by week, month by month, we'll find that those tissue planes are not as rubbery and thick and dense. They're thinner. The scars actually become more pale and a lot less sensitive. My PTs I get to work with, my myofascial therapists I get to work with, we will work together on scars that we think may be contributing to that patient's presentation of either movement inhibition, pain, discomfort, numbness. Two examples come to mind. Was an older client who had gone through, we'll call it a tummy tuck procedure, where the scar pretty much goes all the way around the midline on the right, all the way over to the left side, all the way across the midline. And her main complaint was she couldn't reach with her one shoulder as high up as she could with the other shoulder. So if you check the fascia, the tissue, the soft tissue around the scar, it turned out it was quite tight. So we did injections week to week, and it was amazing to see that she could actually reach her shoulder a lot higher, which expensive. We're again thinking about these type of models where if we have connections with fascia that go from one part of the body to the other, it's understandable why those injections would help in remote and local areas. Another example was a colleague of mine in the Washington, D.C. area who had treated a patient who had presented with chest pain. She had also undergone an abdominal surgery that in the repair, tissue was moved upward toward the chest wall, and she was complaining of chest pain. And knowing all about scars, he very responsibly treated the scar that had actually been more anatomically located in the lower abdominal area, but it was transmitting fascial restriction, tension, if you will, up to the chest wall. So by reducing inflammation in that lower scar area, her chest pains got better. So these are some few and very significant examples of why we find scar deactivation, getting rid of scars, which are sometimes just cosmetic, but sometimes they may be provoking problems with pain, we include that in our treatment. So I wanted to include that with a citation that I put on my blog many years ago, but we find continuing that with different types of scars, it's part of our overall treatment, no matter how far long ago the scars may have actually been produced. So with that, I want to wish you all a good rest of your day. And if you have any other questions, feel free to reach out to me. You can leave a comment here or find me on the web, and I'd be happy to answer your questions. And I, again, hope that you find this information very helpful, and you take care. Bye-bye.